At 10 o'clock in the morning, I found a patient looking lifeless in bed, but before entering the room, I should check if the scene is safe, free from any spillages, cords, or cables that may pose risk to me, my patient, or the rest of the medical team. Once I can check that the scene is safe, I will now perform a quick hand rub, since it's an emergency situation, and don apron and gloves if applicable. And then approach my patient. Hey, are you okay? Hey, are you okay? There's no response. I'm now going to squeeze the trapezius muscle. Since there is still no response, I'm going to call for help, and press on the emergency buzzer. Making sure that the patient is lying on their back, I'm going to expose their chest minimally while maintaining privacy, and visually check for the airway for any obvious signs of obstruction. Since there is none, I'm going to open the airway using head tilt chin lift and perform jaw thrust maneuver if there is any signs of suspected spinal cord injury. I'm now going to perform the look, listen, and feel approach by hovering the side of my face towards the patient's mouth and nose, simultaneously checking for the rise and fall of the chest, listening for breath sounds, and feeling the carotid pulse for up to 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. There are no signs of life. I'm now going to start my compression. Call 2222, alert the cardiac arrest team, and bring in the crash trolley attached to an automated external defibrillator with a bag valve mask attached to 10 to 15 liters of oxygen. I'm now going to start my compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Rescue breath 1, rescue breath 2. While maintaining head tilt chin lift, second cycle. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay. Rescue breath 1, rescue breath 2. While maintaining head tilt chin lift. Third cycle, 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Rescue breath 1, rescue breath 2, while maintaining head tilt chin lift. 1 and 2 and 3 and 4 and 5. Okay, can somebody take over my compressions? Let's switch in 3, 2, 1, switch. My name is Claudine and I was the rescuer who attended to the unconscious patient. I'm now going to hand over the patient using S-bar approach to the second rescuer, informing them that I have delivered 3 cycles of 30 compressions and 2 ventilations. During my compressions, I made sure my arms were straight and elbows were locked and placed at the lower half of the patient's sternum. My rate of the compressions was 100 to 120 compressions per minute, at a depth of 5 to 6 centimeters, allowing for full chest recoil and minimizing interruptions between cycles. During the ventilations, I used the bag valve mask, making sure to avoid rapid and forceful breaths, allowing for rise and fall of the chest, and this is done within less than 5 seconds. The reversible causes of cardiac arrest is hypoxia, hypothermia, hypovolemia, hypo and hyperkalemia, toxins, thrombosis, tension pneumothorax, and cardiac tamponade.